All right, let's bring it back home now, because a stay in hospital can be one of the scariest times in our lives, or for those of your loved ones. So this morning in our regular health segment, we're going to look at the ways healthcare teams and families can step up when things aren't going great to ensure that patients get better treatment. Infectious diseases paediatrician Dr. Lenny Fuong joins us now on the couch. Lenny, good morning.
Good morning.
It's quite incredible to reflect on what's going on in Gaza with Australian doctors who are volunteering their time.
Absolutely.
What they're seeing in hospital is extraordinary, Lenny.
I know, it blows my mind. It's really hard to watch, actually.
Yeah. Let's bring it back here, where we've got better supplies and much better care than some other parts of the world, thankfully. But hospitals can be confusing places, especially when you're under strain, can't they?
Definitely. So hospitals can be quite overwhelming and confusing. You know, I think when you walk into a hospital as a parent or as a patient yourself, you can often feel like there are lots of things going on. It seems like chaos, but actually it is ordered chaos. You've probably heard terms like triage before. And I think really what I wanted to kind of bring the message today to people watching is that there are actually systems in place to try and keep you safe when you are in hospital, but also that families and patients play a huge role in that sort of partnership of care. So we as doctors can't do our jobs unless parents, patients tell us how they're feeling, and we are guided very much by what we see and what we hear from them.
All right. So how are hospital teams keeping patients safe? What are some of these calls you hear over the intercom?
Yes.
What should we be thinking?
Absolutely.
When you hear that?
So you've probably heard before the hospital announcements. So apart from the everybody leave because visiting hours are over. Certainly you hear things like MET calls, which are the medical emergency team calls, code blues, code green or code pinks in obstetric hospitals when there are obstetric emergencies. Okay. And I think really suffice to say that the things that we do in hospitals, there are three main sort of areas that we can put it down to. There are early warning systems. So we have, charts where we look at almost coloured observations, so blood pressure, heart rate, when they are out of range for patients. So that's kind of a visual observation. And then there are staff-initiated calls, like the MET calls and the emergency team calls, where we essentially bring in resuscitation teams and equipment to deal with what's at hand. And then there are family-initiated calls. And so this is kind of a new concept that's becoming more and more prominent as we talk about patient-centred care. And so here what we see is that when a parent or a patient feels like things aren't sort of boding well for them, they feel like something is happening and they're not being listened to, there are processes within the hospital to keep them safe. So firstly, it's, speaking to your bedside nurse and letting them know that you're worried. Then it's, if there is a nurse in charge, there's often that escalation, speaking obviously to your treating team and doctors. And then in certain hospitals, there are different escalation methods. So some hospitals have phone numbers that are an internal phone line to say, somebody, please escalate my concerns. And then in Queensland, there's something called Ryan's Rule, which I thought was quite interesting. So Ryan's Rule essentially is where you can call a statewide system, so a statewide phone number, to say that you are worried about yourself or a patient in hospital within the Queensland health system, and that is an escalation that goes through to a senior clinician in the hospital to call a review and assessment of that patient.
Okay, that's so interesting, and that's obviously been named after someone.
Yes, correct.
Set up in the system. I'm thinking of if you've got perhaps a little child with you, because often we can clearly communicate what's happening, most of the time with our own bodies.
Yeah.
But if you've got a little person who's you're not really able to hear them speak about what's going on, but you're noticing signs of deterioration.
Yeah.
How do you raise your voice in those kinds of places? So
I think it's, all those mechanisms. So speaking to the bedside nurse, speaking to the treating team. I think what's really important as parents, especially as a paediatrician, I think that we are so attuned to listening to parents. Like, your child best. There are subtle signs, changes in behaviour that we don't know because we don't know your child as well as you. And so I think it's really important that parents feel quite empowered to speak up when they think that something's not quite right.
Oh, it's always that intuition, that gut feeling.
Yeah, that gut feeling.
You're noticing.
So important.
A couple of simple tips for parents and families in the hospital?
Yeah, definitely. I think the first thing is just to be, to not be afraid to ask questions when you are in hospital. Certainly if you think about, what's happening to you, what are the next steps? What am I expecting in terms of my treatment? What do you think? How are we going to go from here on? I think the second thing is always kind of keeping that open conversation with the nursing team, with the doctors and the allied health. But also just knowing that your voice matters. I think that is one of the most important things in terms of how we are able to better manage patients, but also how you're able to advocate for yourself and your loved ones.
Oh, brilliant. Always.
Particularly with little kids.
Particularly with little kids.
You're always a bit more on edge, I think.
Exactly. Yeah. No, I completely agree.
Thanks, Linny. That really helps us sort out that confusion when you're in that ED or in the hospital bed as well.
No worries. Thank you.
See you soon.